the humerus bone. It is the bone of the arm. It is the longest bone of the upper limb. This portion is the anterior portion of the humerus, and this is the posterior portion of the humerus bone. This side is the medial side, and this side is the lateral side of the humerus bone. It has an upper end, a lower end, and a shaft. The side determination of the humerus. The upper end of the humerus is rounded to form the head. This is the head of the humerus. And the lower end is expanded from side to side and flattened from before backwards. The head is directed medially upwards and backwards. Upwards and backwards. This is the lesser tubercle of the humerus. It projects from the front of the upper end of the humerus. Next, talking about the humerus. At first, the upper end. This is the head of the humerus, which is directed medially upwards and backwards. The head of the humerus is articulates with the glenoid cavity of the scapula to form the shoulder joint. This is the head of the humerus, and this is the glenoid cavity of the scapula. The head of the humerus articulates with the glenoid cavity of the scapula to form the shoulder joint. The head of the humerus is much larger than the glenoid cavity of the scapula. This joint also called the glenohumeral joint. This joint also called the glenohumeral joint. This line is the anatomical neck of the humerus, which separates the head from the rest of the upper end. This is the anatomical neck. This is the lesser tubercle of the humerus. It is an elevation on the anterior aspect of the upper end. And this is the greater tubercle of the humerus, which is an elevation that forms lateral part of the upper end. Its posterior aspect is marked by, this is the posterior aspect of the greater tubercle, which marked by three impressions: upper, middle and lower. Next is the intertubercular sulcus. This is the intertubercular sulcus or bicipital groove, which separates the lesser tubercle medially from the anterior part of the greater tubercle. It separates the lesser tubercle medially and the anterior part of the greater tubercle. This sulcus has two lip, medial lip and a lateral lip. Medial lip and the lateral lip that represent downward prolongations of the lesser and greater tubercle. A narrow line separating the upper end of the humerus from the shaft of the humerus is called surgical neck is called surgical neck here. And a morphological neck lies above the 0.5 centimeter above the anatomical neck. Here the anatomical neck is present just 0.5 centimeter above there present a morphological neck. A morphological neck. A morphological neck is present. It is shows the position of epiphyseal line. It shows the position of the epiphyseal line. Okay. Talking about the features of the shaft. The shaft is, this is the shaft of the humerus. The shaft is rounded in the upper half and triangular in the lower half. It has 3 borders and 3 surfaces. 3 borders and 3 surfaces. 3 borders: anterior border, medial border here, and the lateral border here. The upper 1/3 of the anterior border forms the lateral lip of the intertubercular sulcus. Forms the lateral lip of the intertubercular sulcus. This is the lateral lip. Okay. In its middle part, it forms the anterior margin of the deltoid tuberosity. Deltoid tuberosity is that where the all fibers of the deltoid muscle are attached on the shaft of the humerus, and the lower half of the anterior border is smooth and rounded. The lateral border is prominent only at the lower end, where it forms the lateral supracondylar ridge. This is the lateral supracondylar ridge. This is the lateral supracondylar ridge. Okay. In the upper part of the lateral border, it is barely traceable up to the posterior surface of the greater tubercle. Posterior surface of the greater tubercle. In its middle part, it is interrupted by a radial groove or spiral groove. Here. Next is the medial border. The upper part of the medial border forms the medial lip of the intertubercular sulcus. Medial lip of the intertubercular sulcus. About its middle, it presents a rough strip which is continuous below with the medial supracondylar ridge. Here, this is the supracondylar ridge. So, this is the medial condylar ridge, supracondylar ridge, and this is the lateral supracondylar ridge. Next, the surfaces. The shaft has three surfaces: anteromedial surface, anterolateral surface, and posterior surface of the shaft. The anterolateral surface lies between the anterior border and the lateral border. Here, anterior and lateral border. Here present the anterolateral surface. The upper half of this surface is covered by the deltoid. A little above it, the middle, it is marked by V-shaped deltoid tuberosity. V-shaped deltoid tuberosity. This is the deltoid tuberosity. V-shaped deltoid tuberosity. Behind the deltoid tuberosity, the radial groove runs downwards and forwards across the surface. Runs downwards and forwards. Here. Next, the anteromedial surface, which lies between the anterior and medial border. The anteromedial surface lies between the anterior and medial borders. Its upper one third is narrow. It's narrow and forms the floor of the intertubercular sulcus. This is the floor of the intertubercular sulcus. Next is the posterior surface of the shaft. This lies between the lateral and medial border. This posterior surface lies between the lateral and medial border. Its upper part marked by oblique ridge, and the middle one third is crossed by the radial groove. This is the posterior aspect of the humerus. This is the radial groove. Next, the lower end of the humerus. The lower end of the humerus forms the condyle, which is expanded side to side and has articular and non-articular parts. Now talking about the articular parts. At first, the capitulum. This is the capitulum. It is the rounded projection which articulates with the head of the radius. Next, the trochlea. This is the trochlea. It is a pulley-shaped surface. It articulates with the trochlear notch of the ulna. This is the middle edge and this is the lateral edge of the trochlea. The middle edge of the trochlea projects down 6 mm more than the lateral edge. The capitulum and the trochlea are the articular part of the lower end of the humerus. Next, talking about the non-articular part of the lower end. The medial epicondyle. This is the medial epicondyle of the humerus. This is the medial epicondyle of the humerus which present at the medial side of the humerus. And this is the lateral epicondyle. This is the lateral epicondyle of the humerus which present the lateral aspect or lateral side of the lower end of the humerus. The medial epicondyle is prominent bony projection on the medial side of the lower end. It is subcutaneous and it is easily felt on the medial side of the elbow. It is easily felt on the medial side of the elbow. The lateral epicondyle is smaller than the medial epicondyle. This is the lateral epicondyle of the lower end of the humerus. It is smaller than the medial epicondyle and its anterior lateral part has muscular impression and a sharp lateral margin just above the lower end. This lateral margin is called supracondylar ridge, and medial margin of the lower end just above the medial epicondyle is called the medial supracondylar ridge. This is the coronoid fossa. It is a depression just above the anterior aspect of the trochlea, just above the anterior aspect of the trochlea, just above. It accommodates the coronoid process of the ulna when the elbow is flexed. Next, this is the radial fossa. It is a depression present just above the anterior aspect of the capitulum, just above the anterior aspect of the capitulum. It accommodates the head of the radius when the elbow is flexed. And the olecranon fossa. The olecranon fossa lies just above the posterior aspect of the trochlea, just above the posterior aspect of the trochlea. It accommodates the olecranon process of the ulna when the elbow is extended. These all are the features of the humerus. The lesser and greater tubercle and the coronoid fossa and the radial fossa, capitulum and trochlea all are the bony landmark of anterior aspect of the humerus, and the medial epicondyle is the bony prominence as medial aspect of the humerus, and the olecranon process is the also bony prominence of the bony landmark of the humerus as the posterior aspect.